Welcome back in. Another opportunity for making the rounds. We have Dr. Brittany Mock, literally just getting into the studio moments ago, from Mobile Infirmary to talk more about the importance of taking care of your health. And it can be difficult. A lot of students out back in school, parents are still trying to get caught up with all of that, you know, and it's important to make sure that you are taking care of yourself.
And our own health is very easy to put off, especially when, you know, we're not having active symptoms.
Right.
It's usually on the back of our mind, especially with kids and focusing on them. But our health is important, especially before we start having signs or symptoms of something going wrong.
I do want to kind of take it back just to the beginning here and talk specifically about what is primary care, because I think people hear that word and they have a general idea of what it means, but what does it mean to you?
So primary care to me is it's your primary point of your care, and it's the person or the care team that you're going to that is coordinating your care, that is also focusing on wellness and preventive medicine to prevent a lot of the chronic conditions we see. To catch things sooner, a lot of screening is important, and so we're able to easily be accessible, as well as coordinate your care with subspecialists, with physical therapy, and we can do it from all ages. Yeah,
and you hit on two very important aspects of having a primary care physician. It's for that prevention, and it's also to make sure that you are checking in periodically so that if something does develop, you are not caught off guard and in a later stage of whatever that is. What type of patients do you typically see?
So as an internal medicine primary care clinic, we see 18 and above. We see more commonly patients 50 and over, as that's where they're more likely to start having signs and symptoms, but we recommend starting early and establishing with a care team that you trust and you feel comfortable talking to and coming when you are sick or when you need a checkup.
It's not easy finding a physician, especially when you have relocated to a new area. We have a lot of people doing that who are probably watching right now new. What would you tell them in terms of finding a primary care physician?
So honestly, I like finding many other professionals, asking around, ask if somebody has that relationship with their doctor where they trust them, they appreciate, they get the education that they need as well as the care that they need. I tend to look, I like teaching institutions because they kind of stay up with the most up-to-date recommendations. So looking at local primary care centers, there's family medicine as well as internal medicine. We just opened up a brand new internal medicine resident clinic here at Mobile Infirmary, and that's part of what I love is teaching residents to be better doctors and to develop that relationship with patients.
We're almost out of time here. Is there anything else that you'd like to add for people watching right now?
I would say if you haven't seen a doctor in a few years, finding one that you trust and that you like, and just getting a health screen, just a physical, is very important. The younger you are, the less often you have to do that. But having that peace of mind that everything is going okay, or if we catch something early, that you've caught it early and you've got the treatment and the care you need.
Awesome. Doctor, thank you so much for stopping by.
It's my pleasure.